Good afternoon. I'm Janet Rich Edwards, and I'm an epidemiologist and associate professor at Harvard Medical School and Harvard School of Public Health. I am really glad to welcome you today to this session titled Critical Public Health Questions for 2021, Closing and Reopening Schools and Workplaces. This event is the second in a three-part virtual Radcliffe series as we begin a new year and a new administration in the midst of a global pandemic when many important public policies are being re-examined. Last week, we featured a panel on addressing inequalities in education, and 1 week from today, we'll focus on changing carceral systems through compassion practice and research. Each session in this series focuses on a single topic area to consider current policies, barriers that impede progress, and ideas for meaningful policy change with particular emphasis on those that reduce racial disparities. We're gathering experts from academia and practice communities to bring together cutting-edge research with real-world challenges and solutions. Before we begin, I want to take a moment to acknowledge the members of the Radcliffe Institute Leadership Society and our annual donors who are watching this afternoon, probably from their offices and bedrooms. Your generosity keeps Radcliffe programming free and open to the public, and we thank you. I also want to thank my colleagues, Sarah Blyke, Carol F. Fortzheimer Professor at Radcliffe and Professor of Public Health Policy at the Harvard Chan School of Public Health, who led the organizing committee for this series and has since joined the Biden administration. The COVID-19 pandemic is the greatest public health challenge in more than a century and has forced many hard choices and decisions. The partial or full closures of schools nationwide have reinforced the critical role that schools play in supporting the health of our children and have become a flashpoint with very strong opinions on both sides. As we move toward reopening schools and other workplaces, it's clear that the buildings themselves are vital to the public's health, and proper ventilation and air filtration have become essential to slow viral spread. Today, we're joined by leading thinkers in public health who bring different perspectives to the discussion of disparities and issues related to school closures, as well as strategies to enhance the built environment as we move carefully towards reopening our workplaces and schools. We're lucky to have two speakers with us today who are at the forefront of these conversations. Dr. Lena Wen is an emergency physician and public health professor at George Washington University. She's a contributing columnist for the Washington Post and an on-air commentator for CNN as a medical analyst. Previously, she served as Baltimore's health commissioner. And Joseph Allen is an associate professor of exposure assessment science and director of the Harvard Healthy Buildings program at the Harvard Chan School of Public Health. So the format of our program today is a discussion followed by audience Q&A. We encourage those of you watching on Zoom to use the Q&A feature at the bottom of your screen to submit your questions at any time during the program. And the speakers will address as many as they can. Since we anticipate a lot of questions, we ask that you please keep them short. This will increase the likelihood that we can address as many as possible in the time we have. And now let's begin. Lena, can you please kick us off by giving us a sense of where we are with the pandemic and what you think the next few months will look like? I'm especially interested in your thoughts on vaccine rollout and how this impacts our children.
Well, thank you very much, Shannon, and it's great to join you and Professor Allen in this conversation today. So where we are in the pandemic is a challenging place because we are once again at a crossroads. And what I mean is that there is actually a best case scenario that frankly is not a great scenario because we have already seen so much death and so much preventable infections and tragedy. But we could be at a place where we are finally going in the right direction, as in we're seeing the number of infections actually trend down after the holidays. We're seeing hospitalizations no longer on that steep increase as we saw before. And it's likely that deaths will come down because deaths are a lagging indicator. We could be at a turning point with warmer weather coming, with vaccinations beginning to gain steam. We could actually be headed to a better place. But we also have the challenge of these emerging variants. The CDC has projected that by March, we could see the B.1.1.7 variant, the variant that originated in the UK, be the dominant strain here. And something that's a lot more transmissible. We've seen the harm that this has inflicted on the UK. We've seen what happens in other countries. And I think there could be we could be in for a next surge that worst case scenario could be even more catastrophic than anything that we have seen to date. And so we're really at a crossroads. And I think so many times in this pandemic, we've talked about this, that where we go depends on the actions that we take. The
Mhm.
actions that we as individuals take. There are already states that are loosening their restrictions, even though we're still at a very high point of infection. And at the same time, vaccine rollout needs to be expedited as much as possible. So Janet, you were asking about where we are with vaccines. Um, I think we're finally to the point where we are reaching more than 1 million vaccinations done a day. President Biden, as you all know, has said that we should be aiming for 100 million vaccinations in 100 days, which is essentially at the rate that we're at now. So I'm hoping that we can substantially ramp up vaccinations after that, because I do think that getting teachers vaccinated, along with really everyone vaccinated, that vaccines ultimately are going to be our pathway back. Although keeping in mind that that's not going to happen for the immediate population or for the population in the immediate future. And so other steps are also what we have to consider as we think about these challenging issues of schools coming back.
Thank you, Lena. It is a sobering juncture, and we've been through many sobering junctures, and it's so hard to predict the future. So I really appreciate your thoughts on it. Joe, we've learned a lot about COVID-19 over the past several months, and there's a lot we don't know, especially about these new variants. Can you share your perspective about what the science currently tells us about reopening schools? Specifically, I'm interested in what's the risk of COVID-19 infection and serious illness in children? And what do we know about school-based outbreaks, the risks to teachers, to staff, to other students? And what's been the effect of school closures on overall community COVID-19 rates?
Yeah, so first, great question, set of questions. And so thanks for having us. Appreciate the Radcliffe Institute for the invitation. It's nice to join you and Dr. Wen. I'll take everyone's lead and use first names here if that's okay. Please call me Joe too. So a couple things that we've learned that, by now we actually know the playbook in terms of the hierarchy of controls or the types of controls that need to be in place to really drive down risk. And hopefully everyone's familiar with these at this point. So it's the basics, and it applies to schools, offices, and everywhere else we'll talk about today. But really, we've driven down risk through a handful of these non-pharmaceutical interventions when they're strictly applied. Good hand hygiene, hand washing, absolute must, universal masking. Wrote an op-ed 2 days ago in the Washington Post calling for better masks. So we can talk about that if you'd like. And then very importantly, physical distancing, and what was ignored early on in the pandemic, but I'm grateful or glad to see that this is finally caught on, is that we need to pay attention to our buildings. And that means better ventilation and better filtration. I'll answer your question about schools in a second, but I thought I'd do a on-the-fly experiment here because I know we'll be talking about ventilation. Here's the CO2 concentration in my office right now, 1,800 parts per million. Typically, you want about 1,000 parts per million. I just want to show that because my windows are closed, but I'm going to pop them open, and we can check back at the end to see if I've improved the ventilation just in my office. We can use this kind of monitor. And so when we think about schools in particular, the same kind of controls apply. My team has written a 60-page risk reduction report, holistic risk reduction strategies. And we think about kids first. Maybe I'll say first, I want to be clear, our plans are designed to protect both kids and adults. But your first question was about kids. We know the risk profile is really remarkably different for kids. This virus has not spared us in any ways except this one, where the risk of the infection, risk of dying from this virus in kids, latest reports out of JAMA is 10 to the -6 or 1 in 1,000,000. So we're really quite fortunate there. There's no such thing as zero risk. Kids can get it. Kids can transmit it. But it looks like particularly the younger kids transmit less than adults. So we get some major benefits here in terms of kids and risks in schools. But it cannot be schools as usual. We have to put in these stringent risk reduction strategies. Now, if you look at the data out of Europe from the spring and even through this fall, what we know about camps through the summer, and even schools in the United States through this fall, including a new CDC report and CDC conclusion that there's little evidence that schools are contributing in a meaningful way to community spread. And yesterday, or I think it was yesterday, maybe the day before, they released another new study out of Wisconsin, 17 schools, in-person instruction, good controls in place, 30% lower transmission in schools than in the community. That's really consistent with what we've seen from other studies. So we, of course, have to do our job in controlling community spread. That said, the costs are just so severe to having kids out of school that it's imperative that we get them back. And to do that, we need to put in these really stringent risk reduction measures in schools that we know can protect kids and adults.
Thank you. I'm actually really curious as well about the new mask recommendations you've got.
Yeah, sure. So I've been thinking about this for a long time, been a proponent of masks from the beginning, as I think many of our colleagues are, and but a recognition that with this new variant, and we have cases as Lena described exploding, and a new variant on the horizon that's more transmissible. It seems clear to me from the indoor air quality modeling that we do and risk modeling that the most effective way to quickly drive down risk is to start using better masks. And just to put a quick note on this, a typical cloth mask might get you 50% capture efficiency. Blue surgical mask might get you 70%, which might sound low, but don't forget it has to go through 2 masks. And 70 and 70 gets you combined 91%. Still not 95 and 95, but not so bad. If we start upping our game and start wearing these N95s, even though there's shortages right now, or KF94s out of Korea, you start to get 99% exposure reduction through the simple act of people wearing better masks before distance, which will improve that number even more, and improving ventilation and filtration, which covers the gap between people's masks. So we're a year into this. It's really inexcusable that we haven't provided our healthcare workers with N95s and our essential workers who are dying at rates that are extraordinarily much higher than the community. And we could produce this really 50-cent mask in mass and provide people with the protection they deserve and need.
Thank you for that. That's very helpful to hear about the masks relative to each other in particular. So Lena, let me turn back to you. What's your take on the science and the risk to children and the community if schools reopen? In recent op-eds, you've argued that schools should remain closed. Can you tell us why?
Sure. So, but let me first back up, if I can, for a moment and just put a plug in for Joe's column in the Washington Post, because I thought that was excellent. It was the #1 read op-ed, I think, in the Post, because I think you raise a very good point about the importance of protection. We don't want to make the same mistake again that we did last year. Last year, we didn't know about asymptomatic spread. We didn't know about aerosol spread. We were not recommending masks at the beginning of the pandemic. We are now. And I just don't want us to look past the evidence once again and make a recommendation or be late in making a recommendation, especially at such a critical time. So let me also agree with what Joe said in terms of the evidence around schools. I think it is very compelling. A couple of days ago, the CDC came out with their report about community transmission versus the rate of transmission in schools if mitigation measures are used. And I think that if is really important. What I was arguing, and Janet, you asked a question about the columns that I had written about this. I was not saying that all schools should be closed. Rather, what I was saying was that we should start with the default assumption that schools should be closed unless they have the mitigation measures in place, rather than schools should be open, and then only if there are documented outbreaks do we close them, which seems to be what happened in many parts of the country. Unfortunately, we had an administration, and this is again not a political statement, this is just it's a descriptive statement. We had an administration that focused on this idea of opening schools, and there are, by the way, very good reasons for keeping schools open. We know that I ran school health in Baltimore, and I certainly can attest to all the reasons why schools are critical, of course, for learning and not wanting to exacerbate the already prevalent educational disparities, but also for food that many students depend on in schools, healthcare. We set up a program in Baltimore for getting glasses to every child. And we had estimated that without that program, 10,000 of our kids needed glasses, but we're not getting them. And so, we have seen also significant mental health reasons of not having schools open. I understand that, but there are also real risks to the individuals, not just to the individual students, but to teachers and staff. who themselves may be at higher risk for contracting coronavirus, for having severe effects. And it just, having spoken to many teachers who were very concerned about the prospect of being in an enclosed space with kids who were not necessarily wearing masks in buildings that did not have good ventilation, that where the classrooms, the CDC recommended de-densifying and having pods, but not schools were not necessarily following these recommendations. And so my point was that let's not start with the default of we have to somehow prove that schools are unsafe in order for them to close, but rather let's figure out what will it take for schools to be open. And so, what I have been arguing for all along is ideally, and I think the CDC can still do this, is to say, let's say that there are 3 levels of community spread. Maybe that if the level of community spread is fairly low, and I'm just making up round numbers here, right? But maybe for fairly low levels of community spread, you need to have the following 5 mitigation measures in place. At a medium level of community spread, maybe you need to have these 5 plus you need 10 more. And then if you have a very high level of community spread, you really need to show that things are safe in order to reopen with the following 20 additional measures. Again, the default, because the level of community spread is such that, or just because the level of spread in schools is lower than in the community, it doesn't mean that there isn't existing ongoing risk to the teachers and staff who are in that situation too.
Thank you. That clarification is really helpful. And you allude to sort of the disparities across communities, both in transmission rates, but also I think maybe Joe, you can help us talk about the disparities in physical plant. And and how much do people who are running schools even know what they have available or not, and how to get their schools from point A to point B where they can open more safely.
Yeah, it's an absolutely critical point, because the reality is we're in this problem in this place because we've underinvested in our school infrastructure for decades. And I think many schools are finding that they're not able to tweak their systems, or maybe more importantly, that they don't even know what their systems can and can't do, simply due to neglect. And I should say that makes it sound like it's on the fault of the people running the schools. It's neglect from society for not providing the resources to the schools. And here's an example of this, and talking about the disparities in particular. Let's take ventilation, and if you're not familiar, that's just the amount of outdoor air that's coming in. So the standard for the minimum amount of air that should be delivered into a school gets you about what we call 3 air changes per hour. So the amount of air coming in should change over 3 times per hour in the full volume of the room. That's the minimum standard. By the way, that minimum standard is not designed for infectious disease transmission. It's just a minimum standard that we don't, honestly, so it doesn't smell bad in our indoor spaces. That's what we design our buildings for, this minimum standard. So it's 3 air changes. Typical school, though, gets about 1.5 air changes per hour when we do studies across the US. So typical school gets half of the minimum, and the minimum is not set for infectious disease. That tells you where our problem is. And for reference, my team has been recommending 4 to 6 air changes per hour in classrooms. So there's this gap from the minimum standard and another gap for what schools are actually doing. Then there's a disparities gap. If you look at schools in low-income communities or in schools in Black and brown communities, you find that it's very typical to have buildings that are giving 1 air change per hour. So that gap is even wider to get to our 4 to 6 air changes per hour. We call 6 being ideal. So again, 4 to 6 ideal, 3 is the standard. Most schools 1.5. In Black and brown communities and or lower income communities, we typically find 1 air change per hour. There's that gap that these schools are trying to fix. Fortunately, there are ways they can do it. And to add on to Lena's point earlier, I think that's exactly right. We have to make sure schools have these controls in place. And what I think has actually happened is that the schools that haven't put the controls in place so far, and if they haven't had a problem, maybe they've been getting lucky, but I think our luck runs out.
Yeah.
The new, more transmissible variant. There's much less room for error. So it's absolutely critical we hit this 4 to 6 air changes per hour just on the building side. And some schools just have a disproportionate burden and need the resources to help get there.
That's really helpful. Joe, I might follow up then, like, how hard is it for a school? What do they actually have to do physically to improve that air exchange? And I know that the most recent stimulus has funds earmarked for schools. Like, what do they need to do and how fast can they do it?
Yeah, this is great that there's finally stimulus here. The new administration is taking this seriously, which is a nice improvement. And so we've been really careful with our recommendations to only recommend these improvements that can be done quickly and relatively cost effectively. So on the air quality side, and by the way, to be clear, I'm just talking about the building here. We still have to be sure we're doing everything else, masking, hand washing. But as we talk about the building specifically, you can get this 4 to 6 air changes per hour through any combination of better ventilation or better filtration, right? Any respiratory aerosols that are emitted need to be diluted out of the air or cleaned out of the air through filters. And so simple strategies, if you're a naturally ventilated space, open up your windows even a little bit, even when it's cold. And I'll show you at the end what this can do to our CO2 levels as an indicator of that good ventilation. If you have a mechanical system, you want to bring in as much outdoor air as you can. On any recirculated air, you want to upgrade to what's called a MERV 13 filter. Most schools have a MERV 8 filter, captures about 20% of airborne particles. MERV 13 will get you closer to 80% in the particle size we're interested in. So those two are pretty straightforward and reasonable, can be done quickly. Third one is if you can't do that, old system, old building, maybe you don't want to open the windows when it's cold. I think you should, even an inch or two, best thing you can do, is to supplement with the use of portable air cleaners with a HEPA filter. Now, these are really nice stopgap plug and play measures. They're not cheap, but they're not expensive. I'm not talking about $1 million fixes here for each school. These are the things you could buy at your local hardware store. You can plug them in with the HEPA filtration. You can get, if you size them right, 4 air changes per hour just from these devices. Real simple stopgap measure. My team, if you're interested in the tools or people are interested in the tools, if you just Google Harvard Healthy Buildings Program, you'll find our page dedicated to schools. We have the science that explains all this, and also a nice little tool where you can actually enter the size of your classroom and it'll tell you what size portable air cleaner you need. So really simple strategies: more outdoor air, better filtration on recirculated air, supplement with portable air cleaner with a HEPA filter, and open up those windows.
Oh, great. Thank you very much for that information. So Lena, I want to ask you, the question of whether and how to reopen schools has been argued for nearly a year now. What do you currently see as the major barriers to reopening, and what role do sort of vaccination strategies and rates play in that?
Great question. Yeah, and I do think that we need to have much better defined guidelines. I've been talking to educators, to school administrators, to public officials, and you know what? Everybody, and parents, and everybody is trying to do the right thing. I think so often these conversations get really heated with unions and teachers and parents and so forth. And I think we need to begin with the assumption that everybody actually wants to do right. But when you have very confusing, sometimes contradictory, but for lack of better words, really watered down guidelines. When you look at the CDC's guidelines, they say things like, if feasible, if possible. I think sometimes people will say, well, look, we want to give local people who understand their schools the best, the flexibility. But you actually, I can tell you as a former local official, you actually empower people on the local level to do what's best for their community by having really specific evidence-based guidelines. And so I think that again, I would love to see the 3 categories of how much community spread there is. For a low-level community spread, this is what you need to do. And also, if you are unable to do the following, here's what you should do in addition. So schools that may not be able to, for whatever reason, do the ventilation improvements that Joe just talked about, maybe if they cannot do that, then they have to make the following things available. Or if they now have all their teachers vaccinated, maybe they can scale back on some of these other things that are meant to protect teachers. I mean, whatever those guidelines are, we should see them. And I hope that the Biden team in coming in will really be attentive to what are those combinations of measures that you might need. Certain things are a must. Masking absolutely is a must. Distancing may also be a must, but things like testing, it would be great if we can now have home testing twice a week. But if we cannot do that, in the absence of that level of surveillance testing, what are the other things that we can be doing? Two other things here. One is that I think we need to be very attentive to the variants that are coming. We've seen in other countries that that even though they have been able to keep schools open with the onset of the variants, we've seen the UK close schools, the Netherlands and others shut down schools because of this much more transmissible variant. And so I think that's something else to keep in mind. The other thing too is I think sometimes there is a misunderstanding about reopening schools, that mentally people think, well, if schools are reopened, we can also resume all these extracurricular activities and play dates. And I actually think that a reframing is necessary as well, that in order to have our kids go to school, we also then need to trade off on what else we would want to do, but cannot do. I think so often in this pandemic, we have basically said, we've understood reopening to be a one way. If we are reopening, everything is now fair game. And I think instead we should say, if we want our kids to be back, we cannot also have orchestra and indoor sports and birthday parties and game nights. That I think that kind of trade-off is something that we have not been very good at recognizing. And I just have found it very disappointing to see birthday parties come back and our students in particular are most vulnerable, still suffering from the COVID slide that we have experienced.
Thank you for that. It's a really important point about the trade-offs and balancing between risks and some really genuinely hard choices all around. Joe, how about you? At this point in the debate, what do you see as the major sticking points for school reopening and how can we overcome them?
Yeah, I mean, this is, there's so much that goes into decision-making around schools. So, I don't like the argument that it's, just the science. It's way more complex than that. But in some of these, many schools have actually gotten the controls in place quite successfully. I've worked with many districts and learned that, and they've taken these proactive measures. I think we need a bigger push to be sure that all schools are doing this, because it's clear, at least what I'm seeing, is that many schools are not actually doing it. And I think it speaks to Lena's point she made earlier on clear and consistent guidance. And I'm confident that the reinvigorated CDC will release this. In fact, they're going to. This is part of the plan. Because for the past year, like everything, it's been an ad hoc approach. School districts next to each other, not sure what to do. They're doing different things. States doing different things. We're competing. And it doesn't quite make sense. That doesn't work with the pandemic and a virus that spreads like this. So more consistent guidance. Some of this, or should it have been teams like mine putting together reports on risk reduction strategies for schools? No, we did that as a stopgap measure because it was a gap created by the federal government under the prior administration. And hopefully we'll see more consistent guidance coming out. So there has been a lot of confusion. I think that has caused a lot of the problems, really, because you're getting conflicting guidance from everywhere. If you talk to a different scientist, you saw what was coming out of the prior administration in terms of the lack of seriousness with which they took this virus. In terms of immediate steps, there are things we can do. I mentioned a bunch on the building side, right? The basics of ventilation, filtration, these quick fixes that do not have to be expensive. We wrote an op-ed in August, a colleague of mine, Rich Corsi, and I, showing that for $1 billion, we could put these portable air cleaners with a HEPA filter in every single classroom in the US. That is a simple measure that avoids this problem of trying to figure out, well, how are we going to spend billions of dollars and to upgrade all of our schools? We can't do that in the next 3 months, but the national emergency of schools being closed requires that we act sooner than that. Second, we also need to prioritize teachers for vaccinations. I think that's clear. In my opinion, this needs to be done and prioritized, and prioritizing the deployment of new rapid testing, self-administered tests to schools, so we can protect teachers and also identify what are actual cases or other just cold symptoms or actually COVID in students before we start shutting down entire classrooms. So these are steps we can do right away. The big picture is the one Lena just said, that it comes down to what are we prioritizing? If we prioritize reopening schools above other aspects of our economy, this is, in my view, very straightforward and easy and can be done. but it's true. We have hookah bars open. In my state, we have an indoor water park that's open, yet schools are closed. It's really unconscionable at this point. And so we've failed to prioritize schools. We actually know what to do to keep adults and kids safe in schools, and we actually have the means to do it. Now it's just a matter of, do we have the will to prioritize our schools?
Yeah, good points. I didn't know that about the water park. Yeah, horrifying. Lena, I would love your opinion on the issue of disparities. As you think about the impact of school closures, what concerns you most in both the short and the long term?
Yeah, I mean, I mentioned a bit of that before in terms of the very real impact of keeping closed school of keeping schools closed, and we all know that those who are affected the most by these closures are going to be the students who already suffer disproportionately from many other access issues. We know that private schools that have been able to keep open have had more resources at their disposal, and schools that already had many issues with lack of resources have not been able to do the upgrades that are needed. You know, prior to the pandemic, we had many schools here in Baltimore that did not have heating and air conditioning, where we had to close schools in times of extreme of hot weather or cold weather because of those extraordinary conditions. Can you imagine these same schools somehow also doing the upgrades that Joe mentioned that would actually make them safe? And so we're seeing the exacerbation of these disparities. Tricky issue, though, of course, we know, because it's also the same communities of color of Black Americans, Hispanic Americans, Indigenous people, et cetera, who are also hit the hardest because of COVID-19 and the severe effects from COVID-19 as well. And so we've seen various surveys of how it's also communities of color that are less eager in some places to send their kids back for in-person instruction, in some cases because kids may be coming back to generational and crowded housing where they don't have the ability to physical distance, and where the individuals involved may also be in more severe effects from COVID-19 as well. So a complex issue overall, but I cannot stress more about what Joe said about the trade-offs that we as a society are making or not. We cannot have it all. We cannot have our cake and eat it too. I've likened this, as some others have, to the idea of a coronavirus budget. We have budgets, right? A city has a budget, or a municipality has a budget, and a budget is a reflection of that community's priorities. You don't have limitless resources, so what are you going to fund? Schools, the police department, or what will you be funding? And I think, or in prevention, do you fund prevention, or do you fund only when things happen at the end of the road? I mean, this is a similar case, I think, for coronavirus budget too. What will we spend our limited budget on? If we spend it on bars and restaurants, then we don't have the budget to be also spending on our schools. And I think that all of this, the entire pandemic, has really shed a light on where our society's priorities really are, and the disparities that have already existed. COVID did not create them, but COVID has unveiled them and, very sadly, exacerbated them.
Yeah, I think we are seeing that for sure. I'd like to spend just a couple minutes talking with you guys about workplaces. I know I'm dying to go back to work and see my colleagues and my students and teach in person. Joe, I know you've spent a lot of time thinking about healthy buildings. Where are we in terms of making workplaces healthy enough for employees to return? And what might that sort of new normal look like across the country?
Yeah, so important question, and maybe start recognizing that millions of people haven't had this luxury of work from home or the option to work from home, and society has been dependent on them, and for their work, their essential work. This has put them at higher risk. And so in terms of essential workers, people are already out of their house working because they have to, for financial reasons, need to be supported in terms of things like paid sick leave, prioritization on the vaccination distribution, rapid testing. And this is where the better masks are a must. We need to be supplying our essential workers with this. As we think about office work, return to office work, Here's what we've been talking about since last April is a framework we use in my field of occupational health and safety called the hierarchy of controls. And it's a way to simplify or make sense of all the information coming at us into 5 parts in this hierarchy. The first is eliminate the hazard. We do this for chemicals and radiological hazards. In this context, for biological, eliminating the hazard is prioritizing work from home for people who can't. That keeps them out of this or really reduces their risk. Substitution is number 2. So how do you bring back the people who need to be physically present? And can you screen them before they come in? I'm optimistic about the rapid test, mostly because of my colleagues, Michael Minna's tireless efforts to raise the flag that this is a tool to really slow down the pandemic. Third, engineering controls. These are the healthy building strategies. Same thing we're talking about for schools need to be done in businesses. In fact, they need to be done on airplanes and every other indoor environment, theaters, better ventilation, better filtration. Fourth, administrative controls. This is managing the density of the building, managing physical distancing, managing flows of people through the lobby and up through the elevators, all the administrative things we can do to reduce risk. And 5, and most important right now, is PPE, personal protective equipment. This, of course, is universal masking and hopefully, or need to be, at better masking. If we do all of these things, we can really drive down risk and start to bring people back to offices, people who traditionally work in an office, carefully and safely without overwhelming the whole system. Now, I'll say what I said for schools. I think there are some organizations that are really ahead of this and started to put in these controls back in last March, and they've been really good about it. I've seen them. I've seen it done. I've also seen the opposite, where it's been ignored. And I'll say what I said earlier, that I think that organizations that weren't taking this seriously may have been able to skate by when case counts were low. And that's going to change when we have millions and millions of active cases right now and a more transmissible variant, which by all predictions looks like it will be the dominant variant in the not so distant future here.
Thank you for that. I'm going to ask you to grab, I'm dying to know about the CO2 monitor. Can we look at that now? And also we need to move to question and answer period. So if you, to the audience, if you want to.
Let's do it. So, all right. So I'll put some more. So it's at 870, right? And I've opened up my window maybe 6 or 8 inches. It's cold out in Boston. It's snowing, but I'm fine in here, right? The thermal gradient is just driving the transfer of air too. It started, I forget the number I was at, 1,500, 1,400, something like this. For reference, if you're under 1,000 parts per million, you're meeting, in most cases, that minimum standard. But remember, that's not the standard we want for acceptable indoor air quality. It went up because I'm breathing into it right now. It's measuring CO2. The standard you want to set for classrooms is about 800 parts per million. So, I wouldn't have anyone in my house first without a mask on. I wouldn't have anybody in this room if I had 1,500 parts per million in here. It tells me it's underventilated. But as it got under 800, we're wearing masks. Yeah, I could have that happen. So this is where, you could start to use these kind of sensors. And anyone who's really interested in this, on our school's website at the Harvard Healthy Buildings program, we have a tool that helps you understand how to measure and assess ventilation rates in classrooms. And you can use the same tool if you want for homes or even offices. So it's a trick and a clever way to, I think, to kind of get a sense of the invisible. How well is this space ventilated? You don't really know unless you can actually measure it.
Yeah, fair enough. For those who are interested, and I see in the chat that many of you are, or in the Q&A that many of you are, there's a link in the chat to Joe's website where I think you can get both the report on opening schools as well as a link to the post piece that was up recently. So you guys are asking great questions. I'm going to lead off with one for Lena. Someone asks, our community spread is very high, but they plan to reopen next week with sports. They plan to offer optional pooled testing. How can we respond as school nurses to keep our community as safe as possible? We've lost 2/3 of our Stop the Spread sites.
I mean, I hear this exact same type of question all across the country. Because when you look at, and the New York Times has this great interactive tool where you can program in where you are in the country and look at the level of community spread. I mean, when you look though, as a whole across the country, it looks like the entire United States is a coronavirus hotspot. Yes, there are some places that are much better than others, but as a whole, there is a very high level of spread. Even if we were to plateau at this level right now, we are at 5 times the level that we were at earlier on when we first had a plateau. So we're really not at a great place. Again, I think this is an issue of priorities. I do worry that when schools are reopening, that all these other things that come with schools get reopened too. And I think that communities really need to, and school districts really need to make a difficult decision and make it clear that it's actually the trade-off that we as individuals have to be making too. So if we want our kids to be in the classroom for a certain number of hours a day, what else are we going to be willing to give up as a result of that? I mean, I think there are, and again, I don't know that I'm giving a particularly good answer here, but just to underscore how difficult things are, I would also say, because I think a lot of people are wondering, well, how can we bridge these educational disparities that we're seeing going forward? I think now is the time for us to be thinking through creative solutions on the education front too, having year-round school as an example, or even alternatives to in-person instruction. I mean, I happen to agree with Joe. I think that teachers should be at the front of the line. If, in fact, getting kids back in school is so important, teachers should be at the front of the line. But there also needs to be an acknowledgement that vaccination for them is sufficient. I've also heard some teachers unions argue that we're not ready to be back as long if students are not vaccinated too, we can't come back. Well, if that's the case, teachers should not be at the front of the line. Teachers should be at the front of the line if they are going to be going back into the classroom right after their immunity takes hold.
That's an interesting point. I hadn't actually heard about that argument yet, but that's a really important one. Joe, I've got another question here. It sounds like it's for you. With schools trying to reopen, there's other venues like restaurants, small businesses, sports clubs, et cetera, that want to open. If the safety measures that schools would have to do to reopen were done by others, would it be safe for them to reopen also in greater numbers?
Yeah, the answer is yes, but I'll qualify that. And I think Lena said it really well, and that, in terms of our budget. So, there's going to be some level of community spread. The more we open up, the more spread there will be, which could lead to conditions where more things have to close. So I'm in favor of a slow and measured reopening with schools at that front of that line, if they're not already opened, where they're first to open, last to close, with other things taking a back seat and prioritizing kids and schools. In terms of these other locations, I've done forensic investigations of sick buildings for over a decade, and I've seen cancer clusters in buildings, disease outbreaks in schools, in hospitals. And, there's never a building we came across, even when people think, I'm in the worst building ever. There's never a building we couldn't fix or put in the controls to keep people safe. Really, we know how to keep people safe in buildings. If there's a will, there have to be the resources to do it. And so the same is said for all of these locations we eventually want to get back to and reopen. There are some that are clearly more challenging than others. Big venue places. Right now, we can't bring back 500 people or a couple thousand people to a Broadway show. Will we get there? Yeah, that'll be vaccination, some combination of vaccinations, widespread vaccination and rapid testing. I'm confident in that, but that's for later this year. Restaurants, particular challenge, and same with bars. Because simple reason, right? Mask off. We lose one of those 2 filters I talked about. If everyone even had a surgical mask, 70%, 70%, 91% exposure reduction combined. That's great. Remove a mask now as people are eating, you're back down to 70%. That's a problem. Put a lot of people in there, now you get a buildup of the aerosols. If they're not paying attention to their ventilation filtration, that's going to accumulate over time. That's a high risk, tailor-made for a super spreader event. In fact, if anyone's listening there and they work in restaurants, definitely you should be wearing one of these better masks, N95, KF94, double mask if you have to, surgical with a cloth mask on top for better fit. That's because you only have one-way protection. You're losing the benefit of that second mask. Same thing with bars, same issue, masks off, and alcohol. So where inhibitions come down and people are close together and they're speaking more loudly, higher emission rates. So there are clearly some areas that we know are higher risk. We've seen high profile outbreaks. The controls just need to be a lot more stringent if you're going to reopen those. And they should be, in my view, deprioritized over something that's as essential as schools.
Yep. So a really interesting question. Lena, once we achieve herd immunity, what controls will we still need?
It's a very good question. And I think that, one thing about herd immunity, and I know this is not exactly what the question is asking, but I think it's an important component in answering this question. I think there is this view in the public that herd immunity is like a switch, that one day we're going to hit this magic number, then we're all going to go out onto the street and celebrate and take off our masks and be part of mass gatherings again. I mean, we know that that's not exactly the way that this is going to work. As more people get vaccinated, hopefully the spread of the infection will decrease and more people can get back to some type of normal. People who are vaccinated can probably see one another relatively safely. We can have gatherings with our loved ones again. I mean, it's going to be gradual. And of course, one of the issues we have not yet talked about is that the vaccines are not yet approved in children. And it is going to take some time for us to get those studies done, for the vaccines to be authorized in kids, for kids to be vaccinated, et cetera. And so I think that, I think reaching herd immunity is already a moving target that we can't quite define right now. And as to what happens after that, I think the best case scenario of what happens is that my best case scenario really is that we end up making COVID-19 essentially like the common cold, as in it's something that we could still get, but we don't fear severe illness because we are all vaccinated and it protects us against having severe illness. And if we all see this as a common cold, we could get to the point that we are getting back to life in pre-2019 normal. But I think that the road ahead to try to reach that best case scenario is really difficult. And a lot of it depends on the actions that we take right now.
Yeah, that's a good point. Boy, I look forward to the day where you think of COVID as the common cold. Yeah, that'll be a good day when we get there. Joe, you had talked earlier about transmission, between schools and community. Has the hybrid schooling approach reduced the level of spread in the schools that are using it, or actually increased it possibly?
Yeah, there's less evidence on this front, but there is some indication. And here I'll refer to the work of our colleague, Bill Hanaj and others at the Harvard School of Public Health, infectious disease epidemiologists, arguing for and showing that the hybrid model, despite many schools doing this, can actually increase spread for a lot of the reasons Lena was talking about, where maybe unintentionally it increases the size of our social networks. If we can keep kids and adults safe in school with these controls, then school becomes a safe environment. If you're pulling kids out of that, and parents are forced to, in many cases, have kids be together, come up with alternative learning plans. If kids are doing activities outside of school where they're mixing with a wider population, it's very possible, and we see this, that their risk can increase. Wider social network, and in places that don't have strict controls in place. We see a lot of this with sports, where it's organized paid sports, where they have incentives actually to get kids out there, even if the controls aren't as stringent as they should be. So these kind of things can actually increase the risk counterintuitively. I've always thought, and from the summer have felt this way, that the hybrid model was kind of this place between fully closed and fully open that through the summer people kind of felt good about, but it was really largely undefined, and every school is really doing it differently and has changed it, doing the best they can based on their read of the disease dynamics and the spread. But in a lot of ways, it has created conditions that may be more conducive to spread. If we create schools, if we put in the controls that we know work in schools, and we're strict about it, as we should be, we can keep the risk low. And then this is a place where both teachers, administrators, and kids can feel good about going, because it's an area that will be controlled in terms of, or I shouldn't say controlled, minimized in terms of risk. There's absolutely no such thing as zero risk in anything we do. But with these measures, we feel confident we can drive down risk. Same measures we put in place in the healthcare sector and then have worked.
Yeah, thank you for that. A number of questions about should children wear N95 masks, and what is the appropriate social distancing within a school? Is it 6 feet? Is it 3 feet? People are hearing different things. Lena, do you have input on that?
I would be very curious what Joe says about it, because he, as I recall, had also written an op-ed about distancing in schools. I might have a more conservative approach to this. I mean, I think indoors, the risk of transmission is just higher than outdoors. And I personally would be very uncomfortable being in an enclosed space 3 feet away from people for many hours at a time. And if I were a teacher in that situation, especially with younger kids who may not be able to keep their masks on, and also knowing the behavior of children who are not at home, or sorry, who are not in school, as in the behaviors that they might be engaged in that are risky behaviors outside of school, I personally, if I were a teacher, would be very uncomfortable with that environment. But I'll let Joe speak about the distancing part. As for masks, one thing I want to add about N95s, as someone who spent a lot of time in an N95 mask in my clinical work, I can tell you it's extremely uncomfortable. If I'm doing a procedure in an N95 mask for more than an hour, it becomes almost stifling. It's extremely uncomfortable for an adult who very much believes in infection control and who has done this. I mean, I've worn this, throughout my medical training. So I know, again, exactly where Joe's coming from in terms of we should be recommending high quality masks to people. I also really worry about non-compliance. I would much rather that somebody wears a surgical mask 100% of the time over their nose and mouth than wearing an N95 mask 25% of the time, because it's really uncomfortable to them. I think there are settings that we can set the expectation, and again, I don't know that we can be expecting young kids to be wearing an N95 mask necessarily, but I think let's say for adults, to me, it might make sense if you're on a plane for a long time, maybe wear an N95, KN95 there. But if you're taking a walk outside where for most of the time you're able to keep well distanced from others, I don't think that you should be wearing an N95, because I think the chance of you deciding it's not worth your time, it's really uncomfortable, and you taking it off, or you're loosening the side because it's digging into you so much, I think the chance of that is too high. I've got 2 little kids, including a toddler. I cannot imagine my toddler. I mean, she's not great about wearing a mask anyway, but for him to be compliant with an N95, I think would just not be possible.
Yeah, I agree. And I think one of the key points, and I agree with Lena here on, is, you want to select the mask based on level of risk. So, if you're in a high risk environment, clearly healthcare workers should be an N95 or equivalent. Or if you're an essential worker in a high risk location, you want to do something better than a cloth mask. I don't think all kids need to be in N95s. Absolutely. So you want to match it to the risk. Going out for a walk, you're in the park with a friend, sure, a simple cloth mask, totally fine, low risk environment. So you can match the mask to the risk. Importantly, I think a key aspect of this that needs to be said around masks is that, where's the innovation? We have, over the past year, created a vaccine in record speed. We've created new therapeutics, and yet we're still running around with these same N95 masks we've had for decades. No innovation on comfort, on fit. There are other alternatives. So if you can't get an N95 where it's uncomfortable, the KF94 is a terrific mask, 94% efficient. I wear this one; it's really quite comfortable, unlike an N95 that can be, a bit more restrictive, as Lena pointed out. So our op-ed was really a call for where's the innovation and standardization, because there's so much confusion out there. KF94, KN95, N95, double masking. And we tried to clear that up with that latest op-ed, because it is confusing. And there's counterfeit masks out there. So the average, typical person, myself included, it's really difficult to say, well, what's a good mask if I'm about to buy these for my family? On the point of distancing, I wrote an op-ed with actually Dr. Sarah Bleich, who originally organized this forum a couple months ago, talking about distancing. And here's where we argue that 3-foot distancing is okay in schools for kid-to-kid interactions, but not adult-to-adult or not adult-to-kid interactions. And really it comes from, if you think about where the physical distancing recommendation came from, it was before masks were widely implemented. And very often we think of these controls in isolation. So we want distancing, yes. If you have a good mask on, distancing becomes less important, not important. In fact, in hospitals, right, they can't physically distance. They don't consider it a close contact if they have good PPE on and they're not physically distanced. The problem we saw was that the distancing was being used as a reason, the sole reason, I should say, to keep kids out of schools because there's less space. But if kids are wearing masks and we have these multiple controls in place, including good ventilation and filtration, the strict 6-foot distancing in terms of where desks should not be the sole reason we keep kids out of school. considering the extreme costs of kids out of school. Virtual dropouts on the order of hundreds of thousands, food insecurity issues that Lena mentioned, decreases in literacy gains year over year. We're just starting to see the impact. It'll be many years of seeing the impact of a year of millions of kids out of school. It's devastating. And so the hard rule on 6 foot was being used to keep kids out of school. If you have other strict controls in place, like we have in other environments, we know that that is not the sole determinant of driving down risk. To be clear, and I'll reiterate again, adult to adult should absolutely be distance. We recommend teachers stay distance as best they can from students for the majority of time, recognizing that transient exposures do happen, but kid to kid can be 3 feet.
Thank you. That's really helpful. We are almost out of time, so I want to do like a lightning round. Recognizing there's been this massive human toll due to COVID-19. I wonder if the two of you see any silver linings that we can look to for hope. Joseph, I've got you up on the screen. I'll ask you first.
Well, I'd say I hate to even call it silver linings because this has just been an absolutely horrific year for humanity. But I'd say hopefully it's this, that there's a renewed appreciation of the power of our scientific endeavor. And I don't mean us, I mean the wider scientific endeavor. I think people will be really impressed or hopefully appreciative to know that the scientific community is really quite active even behind the scenes. And I've seen a level of collaboration I've never seen in my entire career, new collaborations with people I've never worked with. So there's a real, maybe that's one silver lining here, is that, there's this newfound collaborations. And two, finally, an appreciation that buildings matter to our health. We have so under prioritized our buildings. We've been in the sick building era for 40 years. And I hope this catalyzes a new movement that says, you know what, healthy buildings should be the norm, not the exception. And it shouldn't just be the shiny glass tower in the middle of Manhattan that is a healthy building, but really healthy buildings for all. We don't even have to think about this.
Yeah, it's true. Lena, how about you? Any glimmers of hope?
I'll piggyback off of what Joe said about what the pandemic has unveiled and the opportunity that we might have. There's a saying that public health saved your life today. You just don't know it. There is no face of public health because by definition, we succeed when we have prevented something from happening. But as a result, we end up being the first thing on the chopping block when it comes to budgets. And in fact, that is why we are in the position that we are in when we have decades of chronic underinvestment in our local and state public health infrastructure, and when we don't focus on prevention and these upstream interventions. And so I hope that this opportunity will not be wasted, because we have an opportunity going forward to reimagine what our public health system should look like, and a renewed emphasis on healthy buildings, and also on all these other social determinants of health.
Yeah, go public health. Your words are music to my ears. So this concludes our program for today. I want to thank both our panelists for your thoughtful perspectives and our audience for your great questions. I'm sorry we couldn't get to every last one of them, especially the ones that came rolling in at the very end. As I mentioned at the top of today's program, this discussion is the second in a 3-part series that's focused on current issues in social policy. The video of the first session about addressing inequalities in education will be posted online shortly. And the final installment of the series, titled Changing Carceral Systems Through Compassion, Practice, and Research, will take place next Thursday, February 4th at 4 p.m. To register for that event and for information on other upcoming Radcliffe virtual programs, please visit www.radcliffe.harvard.edu. Thanks again for joining us today, and take care.